I would have to say that having seen and been through a number of different hurricanes, the level of devastation there is probably the worst that I have actually ever seen. There are 3 main hospitals on the island, only one of which is semi-operational at this moment in time. The other 2 are considered to be so severely damaged without power and roofs that they're currently not operable. The island has a very strange topography to it. It is more of a very steep mountainous island. This means that the logistics of getting around is very difficult. All the roads are cut. It is such a logistical task to get anything in that you're not only will you have those immediate injuries, you'll also have the situation of chronic diseases being untreated or new diseases that are secondary effects of this disaster, such as pneumonia and other kind of diseases that you would get with inclement weather, and a lack of shelter and a lack of access to water and a lack of access to power and food. So we will see a population that will deteriorate significantly in the next coming weeks if assistance isn't given to this population very quickly. So International Medical Corps is working closely in conjunction with the government and closely in conjunction with the Caribbean Emergency Disaster Management Association. We're helping to look at supplying health staff and getting in health staff and rotating them in and out. The sectors that we would be looking at currently are high demand for WASH. So we do have WASH experts coming in. That'll be going to clinics, looking at what the WASH needs are for actually getting these clinics back up and operational. So that includes access to water supply as well as the sanitation side of any kind of clinic and hospital. We will also be supporting teams that are delivering primary health care, and that can be at both the clinic and hospital level. We're also looking at ambulatory services. So actually where a chronic patient cannot receive the level of care required, then they will be evacuated out. We will be taking a look very much at the psychosocial and mental health programming that is needed. We have a lot of very good corporate partners who are being very helpful, reaching out and digging in deep to actually pack kits for us. So we will be looking at the distribution of those hygiene kits, and those hygiene kits will be needed for quite some time. The most important thing is to try and restore the different services of health immediately, and then after that, we've got to actually look at how to recover those services and reconstruct them so that they're more robust and we build back better so that the islands aren't affected in the same way again. The population is resilient. It is moving forward. However, aid is not getting in fast enough, and there isn't enough supply of aid, and the funding needs to increase in order for us to be able to more rapidly respond. The resources, the coordination, and the creative responses that we need to undertake require the appropriate level of funding and the appropriate level of people to be able to respond, and that you will not get the same level of economy and scale that we would normally see in a disaster, and that is just a reality of responding to an archipelago set of islands that have been devastated.